Hello everyone, my name is Dr. Mrs. I. Stella Agyenim-Boateng. I'm the advisor in the office of the Chief Executive of the Volta River Authority, and I'm an HR change maker. Volta River Authority, as you all know, VRA, it's a power generating organization. We generate power for industries, for residential consumers, basically for everything energy and power, and we export energy as well to some West African countries. And so a very critical role in providing power and energy for industries, etc., really made it very, very important for us to set a whole process up to ensure that COVID-19 was very well managed, so that businesses will not be impacted so badly from the power point of view, and individuals and other consumers will also have what it takes to be able to live within that kind of a pandemic. Having said that, I also want to give you a little bit about the complexity of our situation. So when it comes to VRA, we have over 2,500 employees. Again, anyone who knows the setup of VRA, we have several departments, and we have our power engineering and operations. So we have the Akosombo Dam, we have the pond generating station in Akuse, we have our thermal plants in Abuate, in Tema, in Pong. So whilst we're looking at this critical infrastructure and the fact that we have our staff working to maintain and operate these for the nation to continue to thrive even in the midst of COVID, we had to actually put a lot of things in place to make sure that the employees are well managed, taken care of within that situation. What makes it even complex, or made it really complex for us, is the fact that unlike other organizations who were just managing their employees, we had to go beyond managing employees, because we have our enclaves, our work locations where our employees and their families live. So you go to Akosombo, you go to Akuse, you go to Abuaze, and you actually have enclaves or townships where you have your employees and their families living, and therefore you needed to manage your employees, you needed to manage their families. Again, VRA has schools. I'm sure you know our flagship schools, Akosombo International School, and other basic schools across 3 of our locations. And so we had to also put in place policies to manage school children, to manage parents, and then to manage other stakeholders within that setup. VRA also has a subsidiary, the Volta Hotel in Akosombo, and I'm sure most of you have heard about that. And so tourism in itself was also impacted due to COVID. We had to manage that as well. And our lake transport, because you have Dodi Princess, where some of your tourists and visitors will come and make that beautiful journey to the Dodi Island, etc. You needed to manage all that. And so there was a complexity of policies and activities in managing COVID. But the good thing, perhaps, that also happened is the fact that we also have health facilities. So we have our hospitals in Akosombo, in Akuse, in Accra, in Abuate. And so we had the support of our medical team. So basically, in terms of managing COVID, what we did as a start when COVID actually, reared its ugly head in this country, was for us, even before we had the first 2 cases in Ghana, we had actually, because the news was all over, so we immediately set up a steering committee chaired by the chief executive himself, and with the executives and then HR, where every week there was a meeting to assess the extent of COVID, and how it could impact our operations. So immediately we put that steering committee in place. We also set up a task force, and the duty of the task force too was to ensure that our policies in terms of who could work from home and who could work from the office was set out. So working from home policy was one of them, and we made sure that the necessary tools and equipment that employees needed to be able to work from home, if their work actually demanded the use of these tools, etc., were made available. The task force was also to ensure that there's constant fumigation in all our premises, periodically. And then we set out, as most organizations did, sanitizers, for the public and for, visitors who would come, for employees and all that. And we had our hospital to actually produce sanitizers for every employee and our families. We actually created barriers in all our locations. So people who were entering our township were all screened. And we had our medical staff there, supported by some other support staff. Our security were there to ensure that every vehicle or every individual that was to walk through that barrier will have to be screened, your temperature checked, and if they felt that you needed some extra medical attention, immediately our medical team was then referred to the medical, and anybody who showed symptoms, you were tested at the cost of the organization. So for our employees and their families, we test you at the cost of the organization, and then our hospital team, who were part of the task force, will do what we call our own contact tracing. So they will trace all your contacts within a certain period of time, including going into our communities, going into your families, and if anybody had been infected, you were quarantined, and then you were given the necessary medical attention. If it was beyond, your situation was beyond our medical team's capability or facility, then we have collaboration with other external medical centers, and then you're immediately taken over to the medical center. If it happens and you can even isolate, even in the house, we make sure that you are visited by a medical team, whatever medication, whatever procedure was done. But most of the time we pick, because sometimes people might say that they can isolate at home, but you cannot be so sure of what can happen. Naturally, as a person, you would want get in contact with family, etc. And so we always had emergency ambulances ready that will come to your house as an employee, pick you up in a very decent way, take you to our isolation center in Akosombo and in the other locations, to the point where we realized that we needed even more facilities for isolation. We actually rented out some private facilities where our staff who had to be isolated also had the opportunity, and doctors were taking care of them 24/7. We also had the schools, as I said, and there was a time that the pandemic actually became serious, and we had a lot of our school children being infected. So we immediately closed down this. We immediately got all the students who were infected into an isolation center. They were taken very good care of, and initially parents had a little challenge, but immediately they came to see where their children were, the kind of medical attention that they were receiving. They were very satisfied that we were doing a good job. We had, so basically, our policy on working from home, ensuring that working from home was not a holiday, but you actually had to be part of whatever was happening, on site, in terms of meetings. If you had to, be on Teams meetings, you had to contribute to whatever discussion, all that was made available. We also had a psychologist, so our medical team always providing psychological support, for employees through continuous education, Zoom meetings, Teams meetings, to ensure that in this kind of situation, even if people will panic, it will not be to the extent to which it can impact their work and their general attitude. So basically, when it came to that, we actually did a lot to make sure that we settled our employees, psychologically, emotionally, health-wise. We were there to take care. Nobody had to bear any cost of testing or anything associated with it. In terms of performance management, yes. So in a time like that, we needed to be mindful what we're looking at, because this started somewhere in March, very early in the year, and most people had set their targets, or all employees had set their targets. But how are you going to actually evaluate everybody within, let's say, even that quarter or going forward? Because we needed to actually settle people and make them comfortable that they are working for a caring organization. And so we didn't put so much emphasis on, managing your targets and how you were delivering, but we were ensuring that you were in a healthy state and delivering according to the tasks and the revised strategy, the revised target, and encouraging people to actually give up their best. Again, it's important for me to mention the fact that for our core operational activities, so with our thermal plants, with our power plants, our hydro dam, those who are working in hydro, in the thermal, in other critical areas like that, they had to be at work. But we had to make sure that, the shift system was working. We had 3 shifts. So at any given point, there was a standby shift. In the event that any one shift somebody got, COVID, you have to isolate the entire shift and then take them through the normal, process, and be able to still have another shift ready to run, the power systems, to make sure that the country did not suffer any kind of, power crisis when there was COVID. And so our critical staff, we had to take very good care of them in terms of when they could come to the office, what they had to do. Again, you talked about recruitment. I mean, at that point in time, really, it was not the time that you were going to recruit, many more. In any case, because of COVID, we also had to go into heavy use of technology. We had started actually automating a lot of our processes and digitalizing most of our activities. And so COVID did not, take us by surprise in terms of use of technology. So even in situations where we had to actually recruit, if we had to, now we're using technology. So, you didn't need to have in-person interviews. You didn't need to have in-person onboarding process. You didn't need to have an in-person training. We have an academy as well in Akuse, where we train our staff. We train other staff from other power utilities within Ghana and outside of Ghana. We had to cut in-person training programs, but we still had to make sure that we were training our staff. And so, of course, the platforms were created where employees, depending on what training program you have to undertake, they were using the platform. So that e-learning became one of the key things that we introduced. Again, for our students, at the point when you had to even close, the facilities because of COVID, we still needed to make sure that as students, they did not miss out on, their studies. And so we created e-platforms for the teachers and for the students, where the teachers could still deliver their lessons to these students via technology. And so as a power utility, technology is something that we work with every day, as it were. And so when COVID came in, we just had to adjust, in terms of, how far and to what extent we were using technology beyond perhaps the traditional way of using it. And every week, the steering committee was meeting with the task force for updates. So if there was anything that needed to have a better or clearer understanding, our medical team will bring it to our attention, and all other teams that were working. And then we will assess the situation and ensure that we did either this or that to improve. Our national service persons, for instance, we ensured that, they were home for that period, but we still paid them whatever they deserved monthly. All our staff, whether you were working from home or working in person from on site, everybody, there was nothing like a salary cut, there was nothing like benefit cut, there was nothing like reduction in staff strength. Basically, in terms of staff remuneration, staff support, staff welfare, nothing actually diminished. And I think that was a good thing. At the end of it, yes, we had quite some cases, but all of them were managed. I think at the end of the serious COVID, period, we lost two people, unfortunately. But these were individuals who had been given every care that had to be given, but because of some underlying conditions, unfortunately, very sadly, we lost them. But if you look at our population, the number of infections, because of how, the nature of our job and how we live in communities, and how we managed it, I would say that it was one of our success stories. And we actually even got an award, not one, maybe two or more awards, for the way we had managed COVID across the various spectrum, because not, like I said, staff, family, school children, visitors, people who live in Akosombo Township and in other townships. And so, yes, we had to close the Akosombo market, and had a kind of shift system when the market men and women could come, when they could come, and how we could support them, the lorry stations. And because, again, let's remember that VRA has local authority responsibility for Akosombo Township. So we're not just looking at our staff or their families, but the entire township was our responsibility. As part of our support for the government and for various institutions and communities, we also made sure that we donated a lot of COVID items, and we donated, some cash and all to support the whole management of COVID. And within that same COVID period of 2021 was actually when VRA turned 60. So we still had to celebrate our 60th anniversary in a grand style. Could have been grander if there was no COVID, but we did it in a style that really impacted society within that period. As part of our COVID consciousness, we educated our impacted communities, and we presented COVID items and other school-related items to over 16,000 school children within some of our communities, 30 schools across 6 regions. So, we took COVID very, very seriously from all fronts, from recruitment to onboarding to training to performance management to all the other things that you've talked about, beyond our staff, to the rest of our stakeholders that we really feel responsible for. Yeah, thank you.